Hi guys, my name is Annalisa and this is my EBP project. It's titled Routine COVID-19 Testing on CDU's Campus. So first I'll go through the introduction, significance of the problem, my EBP project question, review of literature, summary of evidence, recommended best practice, policy and protocol for practice change, and then implementation and evaluation plan. So for the introduction, during the peak of the COVID-19 global pandemic, there was a significant influx of positive cases, which in turn increased viral transmission between individuals. As a result, the greatest concern caused by the surge of positive cases was infections that led to hospitalizations and, in some cases, fatalities. In fact, millions of individuals lost their lives as a result of this rampant disease, including those with underlying comorbidities and even those in good health. With this, the World Health Organization declared the novel coronavirus a global pandemic. So the significance of this problem. This issue is relevant first because it poses a threat to public health and safety, and secondly, it sets a precedent and provides evidence-based research that can be implemented when anticipating another widespread occurrence of infectious disease. So for this project, my PCOT question and my evidence-based project question was, does weekly COVID-19 rapid testing significantly reduce the prevalence of positive COVID-19 cases among students, faculty, and staff on the CDU University campus as compared to not testing on campus at all? So review of literature. So databases that were used and pertinent to the research topic included cgu.edu, Centers for Disease Control and Prevention, CDC, PubMed, and the National Institutes of Health. And to also guide the literature search, keywords used included variations of COVID-19 data and statistics, CDC, COVID-19 deaths and hospitalizations, impact of COVID-19 in Los Angeles, COVID-19 reports, daily COVID-19 testing on college campuses, and the effects of COVID-19 on university campuses, as well as optimizing COVID-19 testing strategies on college campuses. And a summary of my evidence. So each study below was fairly similar in the methods used to gather data. The dependent variable of interest in research query was reduction in positive COVID-19 cases as a result of routine testing. Furthermore, the study designs were experimental and remained the same between studies. So one of the studies that I found that was pertinent to my project was a case study that was held by Cipriano in 2021. As it pertained to university students, testing every 28 days showed a very small reduction in the number of infections. However, more frequent routine testing every 5 days showed a significant reduction in the total number of infections. Another case held by Johnson in 2022 conducted a study that derived an optimal testing strategy for the University of Texas, a college community of 50,000 students, for the fall semester. This technique would require 75,000 tests to be disseminated among students per week. The study found that the optimal strategy in terms of health and economic costs is twice weekly antigen testing for all students. This strategy provides a 95% guarantee that throughout the fall semester, cases counts would not exceed the CDC's original high transmission threshold of 100 cases per 100K person over 7 days. So recommended best practice. So the best practice, based on the evidence that I found and that was provided, is the use of daily testing protocols on the CDU campus to reduce the incidence and prevalence of COVID-19 and subsequent infectious disease. The data supports that not only does daily rapid testing protect students, faculty, and staff, but by proxy it protects the surrounding communities by slowing the spread of disease while raising awareness of the benefits of early detection. So policy and protocol for practice change. The planned policy for change would be to implement a systematic protocol to be followed daily. Upon arrival on campus grounds, students, faculty, and staff would be required to complete a preliminary pre-screening questionnaire to assess for possible symptoms of COVID-19. Answers to these questions would then determine if an individual would be approved to come to campus or not. In the event that someone was deemed healthy and could come to campus, the protocol would continue. These individuals would then be given a rapid antigen test on campus in designated areas, and results would be made available 15 minutes after testing. Once tested, students, faculty, and staff would have access to their results via their health portal. Subsequently, those individuals who tested positive on campus would be required to leave campus and begin their 10-day quarantine. As a result, contacts who were identified as positive would receive exposure letters, which would include guidelines for safety protocols before being cleared for their return to campus. To ensure safety to all individuals on the university campus, the final component of the planned policy would be to mandate vaccinations as set by local and state governments. Therefore, students, faculty, and staff would be mandated to provide proof of their vaccination status as a requirement when engaging in campus activities. So for the evaluation plan, a multi-layered routine testing plan must be implemented on the CDU campus. Testing refers to screening of all individuals regardless of whether they are symptomatic or asymptomatic. The university must provide an ample supply of testing kits and establish an efficient system for lab processing and provide additional medical and support staff with ease of access. This allows for individuals to receive the proper information about the necessary steps to take in terms of isolation as soon as they are confirmed a positive case. Students should also be provided with web-based platforms to schedule testing preemptively. Additionally, these campus testing protocols should be mandated daily to increase compliance. Testing should be time conscious also and sensitive as to not disrupt the normal flow of the academic environment. Therefore, all individuals on campus grounds should be tested at least 15 minutes prior to entering university buildings. Disciplinary actions will be taken if testing interferes with students' ability to be prompt for scheduled courses. Implementation for procedural testing would be overseen by key stakeholders at CDU, including and not limited to medical staff, school nurses, and even those higher on the chain of command who can promote policy, like presidents, deans, provosts, chancellors, CNOs, and etc. To evaluate the effectiveness of daily testing on the CDU campus and for positive cases, there would be a quarterly analysis of data trends that would be maintained. Data will summarize how some samples or many samples were collected every 3 months, how many tests were rapid antigen versus PCR tests, the number of students, faculty, and staff that were tested in each testing period, and the number of positive tests collected from students, faculty, and staff. This data will then undergo a synthesis process, which would include tables, graphs, and summary statistics, which will clearly outline meaningful trends and patterns. Lastly, chief officers on the university campus will hold quarterly forums to discuss and receive feedback on quality improvement measures and areas needed for urgent improvement prior to the quarterly audit. And here are my references. Thank you.